Hello, Majestic Queen. I am back. This is Dr. O. I am your facilitator for the Majestic Queen audio podcast, where we come together as women to have conversation and to listen to video presentations that will help us to deal with life situations, because Majestic Queen, we deserve a break today. I know that most of you are nurturers of the family, because that is indicative of what we are as women, nurturers of the family. I know that we are nurturers of the community, because that is also a role that we take on. And of course, we are supportive to all people who come in our vicinity, because we are majestic and we are queen, and we are helpful to anyone who needs us. So that leaves us what? Stressed out. That leaves us overwhelmed. That leaves us, Lord, send me Calgon. I need a bath. I need to relax. Get me in the hot water. I don't want to talk to anybody for at least 30 minutes, please. And so, of course, I bring you love and light, baby. Love and light. I am going to be laughing through these presentations, and I hope it brings some laughter to your heart and your spirit, because we don't need to be overwhelmed. So we are in our trauma series, and we must go on. In the last presentation, I gave you detailed information about trauma. And so I will start by giving you a brief definition of what trauma is again, just so that you can remember. Trauma is the body's response to overwhelming stress. It occurs when someone experiences or witnesses an event that threatens their safety or well-being. And so, once again, we have all experienced or seen or heard something that is overwhelming and very stressful to us. It can promote anxiety. And so, in psychology, we often talk about post-traumatic stress syndrome. Let me repeat that. Post-traumatic stress syndrome. And I will go deeply into that before we end this presentation. Just keep it in mind. Most people call it PTSD. Now, once again, towards the end of the presentation, I will give you the information you need about it. But right now, we're going to talk about the different types of stress. So the different types of stress are acute. Let me back up a little. The different types of trauma. That's what we're going to focus on. So the different types of trauma are acute trauma. That means it is one distressing event. It only occurred in a single episode. Then there is chronic trauma. That means there is exposure that is repeated over time. So the trauma occurred more than once. You have complex trauma. That is multiple traumatic events, often beginning in childhood, like, for example, molestation. Then you have secondary trauma. This is stress experienced by helping professionals or loved ones exposed to another person's trauma. So what can trauma do to you or to me or to some significant person that is a part of your circle. Trauma can affect thoughts, feelings, behaviors, relationships, physical health, spiritual beliefs. Here are the signs of trauma. Feeling constantly alert. So that means you're hypervigilant. That means you're startled easily. Trying to avoid reminders is a sign of trauma. Emotional numbness, anger, guilt, shame, blame, difficulty sleeping, panic, and isolation. I want you to realize that trauma is not a weakness, and you do not have to constantly live out the traumatic event or events in your thinking, in your behavior, in your relationships, in your feelings, in your physical health, in your spiritual beliefs. You do not have to continuously live out the trauma. You can break the cycle just by doing the healing activities. The healing activities are in the workbook. The workbook can be sent to you electronically. I only ask for a Cash App donation less than $10. It's just like having a therapy session or sessions for less than $10. So $10 or less. If you decide to send what you can send, $5, $2, $7, $10, it's acceptable to me. I am not trying to get rich. I am trying to be helpful. And the donations will go to some activity that will be planned in the future, or other video creations that I think you can benefit from, Majestic Queen. So please open your heart and donate. There will be good works that come from it. So, Majestic Queen, keep in mind that you can heal. Remember, you must do the work. There's nothing that's going to change in your life unless you do the work. So let's talk a little bit about PTSD. That is post, that means it comes after. Traumatic, that means there's a trauma that occurred. Stress, that means there's some type of stress or anxiety that's happening for you. And it's a disorder. That means that there are many symptoms that are related that a person may feel as a result of being exposed to some type of traumatic event or situation. Now, symptoms can vary over time or vary from person to person. So the symptoms are intrusive memories. That means that you have unwanted, distressing memories of a traumatic event that comes back over and over again. It means reliving a traumatic event as if it were happening again, also known as flashbacks. It means having upsetting dreams or nightmares about a traumatic event. It also means severe emotional distress or physical reactions to something that reminds you of a traumatic event. So that is the category that is called intrusive memories. I need to take a sip Just a minute. I'm drinking tea, by the way. Now, let's go on to the next category. The next category is avoidance. Symptoms of avoidance may include trying not to think or talk about the traumatic events, staying away from places, activities, or people that remind you of a traumatic event. The next category is negative changes in thinking and mood. These are negative thoughts about yourself, other people, or the world, ongoing emotions of fear, blame, guilt, anger, or shame, memory problems, including not remembering important aspects of the traumatic event, feeling detached from family and friends, not being interested in activities you once enjoyed, having a hard time feeling positive emotions, feeling emotionally numb. Next category. Changes in physical and emotional reactions. This means being startled or frightened, always being on guard for danger, self-destructive behaviors such as drinking too much or driving too fast, trouble sleeping, trouble concentrating, irritability, anger outbursts, or aggressive behavior. Physical reactions such as sweating, rapid breathing, fast heartbeat, or shaking. Now, trauma can happen to children too. Children 6 years old and younger may also reenact a traumatic event or aspects of a traumatic event through play, through art. They may have frightening dreams that may or may not include aspects of a traumatic event. So pay attention to your children, especially Majestic Queen. And if we have any kings in the house, pay attention to your children. And when you see behavioral changes, seek out professional help. Now, when you need professional help, see a doctor, your physician, or see a mental health professional. And we can work with you to get through the trauma. So if you are having these disturbing thoughts and feelings about a traumatic event for more than a month, then you know that you need to connect with someone to get some help. Getting help can be found through the Suicide Crisis Center. There are a lot of 24-hour directories that you can find online. So if you want to talk to someone who is a professional and you don't want anybody to know, then you can be confidential because this person will chat with you online. The services are free and confidential. It is called the 988 Suicide and Crisis Lifeline, available 24 hours a day, 7 days a week. You can call or you can text 988. Now, for veterans, they have a different type of crisis line. You can call 988 and press 1. The Veterans Crisis Line will be available to you. You can text 838-255 or chat online. Now, let's see. There's one other thing that I want to tell you about the Suicide and Crisis Lifeline is that there is a toll-free telephone number, 1-888-628-9454. Repeating, 1-888-628-9454 is toll-free. Now, if you feel that there is an emergency, call 911. Do it immediately. Call 911. Please don't sit back, whether it is you yourself going through the crises or there's someone that you know who just said to you, I'm going to kill myself. Take it seriously. Call 911 so that the police can go pick that person up and take him or her to the hospital. And yes, the ambulance will come too. Well, let's go to our activity. But before we do, just remember, trauma is not a weakness. Trauma is an injury that can heal with support and treatment. So here's our activity. Think about it. If you have the workbook, you have the activity in the workbook. After difficult experiences, I have noticed. Now think about it. Trouble sleeping, feeling anxious, mood changes, avoiding people, difficulty trusting others, feeling emotionally numb, physical tension, flashbacks, that means thoughts about the situation, or nightmares. In the workbook, you would check all that apply. The next section is reflection questions. What has helped you to cope? Who supports you? What is one area you like to improve? Well, Majestic Queen, and if there's any kings in the house, this ends the presentation for this evening. Once again, information about Cash App, how to request the actual workbook, how to send an email over to me will be in the description. Until we meet again, I want you to be blessed and to stay safe. Because guess what? If no one told you today, you deserve the ultimate best. Because you are very special. Have a good evening, and I can't wait to speak to you again.